Acute ankle sprains are one of the most common injuries faced by Canadians, affecting over 200,000 Canadians each year. An acute ankle sprain can be classified in three ways: Grade 1 sprains, Grade 2 sprains, and Grade 3 sprains. Grade 1 sprains consist of microtears in the ligament, while Grade 3 sprains consist of full ligament ruptures, and Grade 2 sprains are anything in between. Traditional treatment for acute ankle sprains consists of approximately 6 weeks of physiotherapy. The physiotherapist typically sees the patient once a week to assess their recovery, give feedback to the patient on their gait, and to prescribe exercises for the patient to do at home. The goal of this treatment is to return a patient's gait to normal. There are two problems with this traditional treatment plan. First, the physiotherapist is only able to perform their assessment of the patient for a brief, normally 15 minutes, while they are in clinic together. This brief period does not give the physiotherapist a holistic overview of the patient. They have no insight into their gait in different environments. They don't get to see how the ankle fatigues over hours of walking in a single day. We call this the limited observation period problem. The second problem is that the patient only gets feedback on their gait when they're in the clinic with their physiotherapist. In between appointments, they have no clue how they are doing. They are unsure if they are meeting their goals that the physiotherapist has set out for them. We call this the lack of feedback problem. For the typical acute ankle sprain, the most important gait metric for recovery is the dorsiflexion angle. Dorsiflexion describes the planar angle that the ankle makes between the foot and the leg. Specifically, dorsiflexion refers to these angles when the angle between the foot and leg is less than 90 degrees. There is maximum weight bearing at these angles, making them important for the physiotherapist to track and assess. We propose a dorsiflexion-centric remedy to the limited observation period and lack of feedback problems. We present a non-intrusive wearable sock that tracks dorsiflexion throughout the day. The sock can be worn at all times thanks to its lightweight design. The sock will feed dorsiflexion data directly to the patient's cell phone via Bluetooth. There, the patient and physiotherapist will be able to interact with their data. This solves the limited observation period problem because the physiotherapist will have access to hours of data in between appointments. It also solves the lack of feedback problem because the patient knows whether or not they are meeting their predetermined dorsiflexion goals for the week. The sock will be made of a polyester cotton blend with one sensor located on the foot and the other placed in a case on the leg. This case will house the second sensor, the microcontroller, and battery. It has been optimized to be as small and lightweight as possible while still being strong enough to protect the electronics. Our solution uses two accelerometer sensors to measure the dorsiflexion angle. These accelerometer sensors are wired to an ESP32 microcontroller. From there, the microcontroller sends the dorsiflexion data to a cell phone using Braley. The data is stored and displayed on the user's cell phone. We created a cross-platform app using React Native. The app offers an easy-to-use and clean user interface. The home page presents a summary of the user's dorsiflexion range. The history page allows users to search for average dorsiflexion curves between two input dates. This allows the user to see their progress in between physio sessions. The live page allows the user to view their live dorsiflexion curves. There is also a settings page for administrative tasks. A key aspect of the device is how accurate it can make dorsiflexion angle measurements. The device receives measurements from the sensors that contain noise, which cause the accuracy to be reduced. The design team approached this problem by testing different filtering techniques to address the noise and increase the accuracy. The conclusion from this process is that a Butterworth filter will provide the highest increase in accuracy, and thus the most value for this design. In conclusion, our device solves both the limited observation period and lack of feedback problems. The next steps in finalizing this device are to integrate the sock design, sensor design, and app into one complete prototype. Thank you.